Our first speaker, Mr. Malcolm Portera, is the Chancellor Emeritus of the University of Alabama. He will be speaking on the role of globalization, information technology, innovation, and transforming healthcare. Mr. Portera is the Chancellor Emeritus of the University of Alabama Health System, which is Alabama's largest higher education enterprise. It is comprised of doctoral research, universities in Tuscaloosa, Birmingham, Huntsville, as well as the University of Alabama Health System, which is one of the United States' premier health institutions. He is also leading significant efforts after his retirement in March in terms of global cooperation and joint development activities, to which he'll introduce to you in just a moment. Mr. Portera, welcome.
So, as indicated, I represent a system composed of 3 universities: the original university, which grew out of our College of Arts and Sciences, a medical-oriented institution in Birmingham, UAB, and an aerospace-related university that grew out of the U.S. spaceflight program. This year we will enroll 60,000 students and operate a health system that is a huge enterprise. The heart of, in the area that I will address today, is the campus at Birmingham, at UAB. This is the heart of a cluster of institutions that in all, in a direct and indirect way, employ 100,000 people. The heart of the cluster is our campus at Birmingham. Here is a shot of the cluster from the air, and what you will see is the cluster is composed actually of 10 different hospitals serving a population of a state of 4.5 million people, but in addition to that, a community with a population of 1 million people. At the very heart of this cluster is the University of Alabama at Birmingham Medical Center. We are the second largest academic medical center in the United States. We operate the 14th largest hospital in University Hospital. We are ranked #1 in patient satisfaction locally and score very high nationally. We are one of the first 11 designated comprehensive cancer centers in the United States. Our focus areas as an academic institution and the research areas are in cancer, being one of the first 11 comprehensive cancer centers, in the neurosciences, in cardiology, in diabetes, in infectious diseases, and rheumatology. We were one of the first of the 7 original centers established in 1988 by the National Institute for Allergy and Infectious Diseases, created to stimulate research and scientific advancement concerning AIDS and HIV. This is an area where there is probably as much research going on at UAB in the top 10 of the institutions in the country. The faculty here are credited with research that generated the answer to the question of the origin of AIDS in human beings. Our challenges as it relates to information and information technology in medicine are no different from those that are faced around the world. Patient record keeping. We long for the day when the patient coming into the door comes in with a card, like a credit card, that can be accessed, that describes the patient's entire medical history. At the present time, we have some of that, but we still have too many patients that come in and give secondary data to the physician who is treating that patient. The second challenge and opportunity is the wide distribution of big data. Governmental policy in our country is one that has a significant involvement at the central level, and it appears even more involvement as we go forward with medicine in the U.S. The third is staying abreast of rapid technological advances. Technology is rapidly outpacing the ability of management within our institutions. As an example, in the U.S. in 2010, using smartphones, there were a little over 4,100 apps for health-related applications in 2010. In 2012, there are over 18,000 such apps for smartphones for health-related applications. The final area of challenge, but also opportunity for us, is extending the university with applications to the people of the state and of the community. I'm going to show you a slide in a minute of an initiative that we have undertaken to encourage innovation within the medical enterprise at Birmingham. It's Innovation Depot. We have generated commercial activity from the medical enterprise in Birmingham, and located at the edge of the campus where the faculty are doing research. Innovation Depot, which is an enterprise that is charged with a responsibility to commercialize and to get technology as quickly as possible into the marketplace. We have created, with this enterprise, over 300 companies. Presently, we have almost 100 companies located in the Innovation Depot. We have graduated almost 200 companies. But let me give you examples of the types of companies that are generating out of this enterprise. There are three that I would mention. One is a company called MedMind, using operations research with information technology as a fundamental element. It identifies the source of and therefore prevents the infections in hospitals. This company was created by a faculty member who had an undergraduate degree in computer science and an MD degree. He sold the company for almost $50 million 5 years ago. The second company has been created by the group that founded MedMinds and sold it to assist elderly populations address the problem of the correct medication and on-time medication for elderly populations. It uses an iPhone to identify the types of medication that the elderly should be taking at the appropriate times and ensures that that population receives accurate information. Number three, and will be described tomorrow by Bharat Soni, who's on our faculty, is the use of virtual reality by a neurosurgeon to create a company to train physicians using virtual reality in neurosurgery. The challenges that we have are significant. They are no different from many other institutions around the world. But there's an opportunity that we are promoting at the present time that can best be described with three words: cooperate, collaborate, innovate. We are presently in the early stages of working to develop a global innovation alliance that would include institutions from 6 countries. We are hopeful that the following countries will be represented in the proposed alliance: India, Italy, Argentina, the Netherlands, South Korea, and my home country, the USA. The core focus of the work that we will do will be in the area of medical science and information technology, looking at developments that can occur where the two intersect. We expect that the alliance will include public and private health systems, research institutions, research-oriented universities, and technology incubators. Our goals are 7.